All right, guys, you know what day it is. Welcome back to another For Real for Friday. So today what we're talking about is exercise kind of prescription per se. So how much should you be, being active or exercising, working out, quote unquote, in order to, maintain your stable weight or work on heart health, or if you even want to lose weight. So what we're going to be talking about today is recommendations by the CDC and the American Heart Association. As a disclaimer, I want to say all of this stuff is able to be personalized, and it should be for that matter. So all of these things are good guidelines and they're good things to think about, but finding either nutritionist, physical therapy, something like this, that if you're serious about it and want to have a personalized plan specific to you, I definitely would recommend that. So the first thing that we're going to talk about is just general activity level for if you're just trying to reduce your chances for heart disease, for diabetes, a laundry list of other things. If you're trying to reduce your risk of those things, what the CDC and the American Heart Association recommend is roughly 150 minutes or 2.5 hours of moderate activity exercise, which we'll get into that in a minute, or 75 minutes of vigorous activity exercise, or some combination of both. So the big question is, what is moderate? What is vigorous activity? So moderate, what it kind of falls under is if you are able to elevate your heart rate from what it generally is, and if you want to check that, you can either go to your neck or to that inside part of your wrist, time it for 30 seconds, double it. That's kind of your resting heart rate. If that increases, it gets a little bit harder for you to breathe. You're breathing a little bit more heavy, but you're able to carry on a fairly somewhat easy conversation. That's determined moderate intensity exercise. Now, with vigorous intensity exercise, what it means is your heart rate's going to jump up even a little bit more. You're going to be breathing quite a bit heavier. You're going to be huffing and puffing a little bit. And now carrying on a conversation would be pretty darn difficult. You'd probably have to take some breaks in order to carry on that conversation. These are kind of, very rough guidelines onto what moderate or what vigorous intensity exercise is. So with these guidelines, 150 minutes roughly is what they suggest. So moderate can be a brisk walk, it can be gardening, it can be light yoga, it can be any of these things that just get your heart rate up a little, get it pumping a little, get you breathing just a little bit heavier. Maybe you clean pretty intensely, it can be that too. These all fall under moderate intensity exercise, and this is just for general heart health, for general health of you burning some calories, that sort of thing. Vigorous exercise, I think we all have kind of an idea of what that is in our head, doing something pretty intensely, chopping wood, doing something like that, where your heart rate pumps up quite a bit, and you are actually working pretty darn hard during that time period, which is why it requires so much less time throughout the week. So those are generally just, to be a healthy person, that's what we want to do. We want to move at least that much. Now, if we're talking about weight loss, something like that, a couple of tweaks to this. Still 150 minutes is a really good goal to try to get to with any of this stuff, whether it's for heart health or anything. If you don't do anything throughout the week, don't feel like you have to get to 150 minutes within the first 2 to 3 days. Work your way up to that standpoint. Now, for weight loss, it's a little different. We want you in that moderate activity kind of exercise level. So roughly 60 to 80% of your max heart rate. Really easy way to find your max heart rate is take 220 minus your age. That's your max, and now find your range of 60 to 80% of that. That's not an exact science. There's better ways to find it, but it's really quick and easy way that you can do. So for weight loss, we'd rather have you in that kind of moderate level activity so that you're burning fat the most efficiently. Vigorous activity still burns fat, but you get some other things thrown in there, whereas that moderate activity generally only uses fat or mostly fat in order to burn for energy. And again, continuing to talk about weight loss. So one of the big things is you can either work out crazy intensely and not change your diet, depending if you have, a diet that would be considered not super great, by nutritionists and whatnot. Or changing your diet is also a huge thing. And a lot of the times you hear that diet is 60 to 80% of losing weight. Yes, you need to work out, you need to do that sort of thing. But diet is so important because we're burning those calories. We're trying to, make our body burn more calories and fat than we're taking in. So if we have kind of a poor diet on top of that, it just makes it that much harder. Kind of taking 2 steps forward and 1 step back if you're working out pretty darn hard. So that's also a pretty big thing during it. And again, finding a customized program is huge. So talking to a nutritionist, talk to your doctor, something like that. Again, we as physical therapists, we have some background on this too. So we'd love, even if you want to get in connection with someone else, reach out to us. Like this is what we do, and we want to be here to help you on that path. So all in all, to wrap this up a little bit. One, don't feel like this is daunting. Right away, you hear 2.5 hours, 150 minutes. If you don't do anything, that's totally fine. Start with 40 minutes in the week. You don't have to do 1 hour of stuff at one time. You can take 5 10-minute walks throughout the day, or 2 10-minute walks every single day, and add that up. Make them a little bit more brisk and start to pay attention to your heart rate and start to pay attention to how many minutes you're doing these sort of things, so that you kind of have that inventory of how often you're actually doing these things. So start to move. Our body likes movement. If you have painful joints and these type of things, tons of studies have shown that doing activity on them, moderate activity, actually strengthen them and help them rather than causing more pain or anything like that. So to wrap this all up, reach out if you have absolutely any questions. We are Revival. We come to your home, to your office, whatever. We treat you there. We get you doing whatever activities you want to do. So give us a call if you do have questions, you want to get in touch with somebody, anything like that. Once again, guys, enjoy the snow. It's Friday. Thanks for watching.